a medication called quetiapine or Seroquel. It's a second-generation antipsychotic or a mixed dopamine antagonist. It's FDA approved for schizophrenia, bipolar maintenance, bipolar mania. Can also use it as a depression adjunct. You can use it for anxiety and stable bipolar disorder, You can also use it. There's some literature to support use in OCD or PTSD after trying your SSRIs or other FDA approved agents for that. It's safe in pregnancy, also safe in breastfeeding. You want to take this medication at night because it has a large H1 receptor or histamine 1, which means it helps you sleep and blocks that arousal mechanism. Also hits on some serotonin receptors, 5-HT7A, 5-HT2A, and also hits on NETs, which is norepinephrine transporters, and also at that 300 milligram antipsychotic dose or higher, it also hits dopamine 2 receptors. This medication, the effect size is actually larger than that of the SSRIs or SNRIs for anxiety. It is not FDA approved for anxiety disorders because of the risk of the cardiometabolic effects, like weight gain is one that we see a lot with this medication. Doesn't happen necessarily super often, but it is definitely a risk with this medicine. So that is why the FDA did not approve it, because of that risk of the cardiometabolic side effects, and they didn't think that it was worth it to give it that FDA indication, therefore using it more. Low doses like 25-50 milligrams I've seen can be really effective for anxiety, especially with those that are not sleeping, and we have tried various SSRIs, SNRIs, boost bar, things like that for their anxiety. As far as dosing goes, low is 25 milligrams. Some patients can split it and make it smaller than that, so like 12.5 milligrams or even smaller. I personally have some patients that do that because it makes them too sedated. But typically the 50 to 150, 200 milligram dose is a good spot for those depressive properties. That's where they have the serotonin properties, and then once you get up to the 300 milligrams or higher, the antipsychotic effects, that's where it starts to antagonize the dopamine 2 receptor. So you have those antipsychotic properties in which you could get people out of mania at those 300, 600, 800 milligram doses, for example. So again, quetiapine, Seroquel, it can be a really good option for certain patients. You obviously want to weigh the risks and benefits with your provider, but can be a useful option of a medication for a whole myriad of reasons.